Greetings, and thank you once again for spending a few minutes to learn what's happening here at FHN and throughout our community as it pertains to the COVID-19 pandemic. Today, I'm joined by Tonya Thayer, who is the Executive Director for our foundation, and she's going to share all of the work that our foundation team is doing and our community is doing to help support us during times like this pandemic. So, Tonya, thank you for joining us.
The FHN Foundation raises money to help support healthcare in our community. And by that I mean it may be purchasing equipment, such as the Hannah surgery table that's used for hip replacement. Sometimes it's educational scholarships. It's whatever the tools that our staff need so that they can provide the best healthcare to you. Fortunately, during this pandemic, our community has really responded to our needs. Since early March, we have been in contact with people who want to donate face masks, gloves, N95 masks. We've received lunch, dinner, pizza, donuts, all sorts of different supplies that we've put the call out to the community and they've responded overwhelmingly. We're so thankful, especially safety goggles and gloves. Some of the things that we've had a hard time getting, local manufacturers or companies have been able to donate to us. We really appreciated all the help. And our staff have definitely appreciated when they've received a big basket of fruit or cookies or some other treat to show them that people are thinking about them during their long hours and their difficult work. We certainly are always looking to maintain our PPE, our protective personal equipment supplies. We are expecting a post-Thanksgiving surge, and although we're keeping good eye on our gloves, our masks, our gowns, if there are people out there who have some that they want to donate, we certainly appreciate that. We recently had someone donate some breakfast to us. Now, unfortunately, it's not like the old days where you could put food out on a table. We have to be very concerned about safety, so we make sure treats that are donated are individually wrapped and they can be shared among our staff. People can contribute to FHN by calling our office at 815-599-6900 and letting us know what donation they'd like to contribute, if it's a gift in kind, such as gloves or masks. If they'd like to make a financial donation, they can again contact our office and we can guide them through options. We have online where you can go to fhn.org and there's the Donate Now, Give Now button up in the upper right-hand corner. They can send a check to 1045 West Stevenson Street, Freeport to the FHN Foundation, or they can call and we can take a credit card number over the phone. But certainly any support the community can give us that will help us buy more supplies for our staff, we would completely appreciate. Yes, FHN is a nonprofit organization, 501c3, so all gifts are tax deductible. Our foundation sends out a tax deductible receipt at the end of each year to help people with their taxes. I would like people to remember to wear their mask, to stay 6 feet away from others, and to wash up. If you all could see the dedication of our team here that over the last 8 months now, that they have put forth to try and keep everyone safe and healthy, you would be just like me and be very concerned about being out in the public, being masked up, staying away from people. I don't want to put our teams through any more challenges than they already have. They really want to keep you safe and they're doing a great job of it. So please be safe out there. We don't want to see you inside our hallways. We want everyone to stay healthy and enjoy this holiday season.
The past couple of weeks have certainly been a bit busier. We have seen an uptick in COVID-19 activity with positive patients. Unfortunately, a few that have been on ventilators and in our ICU, and even more unfortunately, we've experienced some deaths that were due to COVID-19. However, our staff continue to do a fantastic job of caring for the families that we serve, and we remain committed to being prepared for whatever may come so that we can best serve our community. I think it's difficult to compare this year to anything average based on all that we've seen and experienced. And it can fluctuate from year to year as to what our activity would look like based upon the strain of influenza, how severe, how significant it is, how well the vaccine was developed for influenza. But I would say some of the things that are really different that we're experiencing right now is that we have limited visitor allowances. We also have been seeing a lot more use of our personal protective equipment across the organization, whereas in normal years or average years, that would only be restricted to areas that had known influenza activity. So it's been fairly atypical than any other year, and it's not really a good comparison because of what we've been doing in preparation and in response to COVID-19. Well, for many that have been keeping up to date, you're aware that the regions are set up on an 11 region basis, and FHN is Region 1, that's Northwest Illinois, and the Region 1 hospitals are connecting with each other on a regular basis. We share information on a daily basis, such as what our current capacities are, what the fill rate is in our intensive care units, how much equipment that we have being utilized. And we also get on regional hospital coordinating calls where we share information, we look at if there is a need, how can we help support each other throughout those needs, as well as looking at what are the other things that we can be doing together that would prepare us to respond better for these type of situations, however that may be. So there's frequent communication that's going on a regular basis throughout the week, including a lot of data or information sharing. As we truly do look at this is that we're all in this together. FHN is working on a plan and has been for several weeks now. We've been working very closely with the state and then also with our regional healthcare systems on what that would look like once vaccine is available. We are confident that we're getting close to some of that distribution, so we want to be able to be ready to administer as soon as we can actually get the vaccine within our facilities to our team. So we're prepared and we're ready to start vaccination. The rate limiting factor will most likely be the number of doses or the amount of vaccine that's immediately available. At present, the CDC is recommending that the first people to get the vaccine are classified under what they're calling Phase 1A. And under that Phase 1A is they're recommending that frontline healthcare workers become vaccinated, as well as long-term care residents and healthcare workers. It's also been discussed about EMS or first responders, so emergency medical services and first responders as well. But right now the priority from the CDC, and it looks as though the state of Illinois is also following those recommendations, that it would be our healthcare workers and our long-term care residents. We hope to learn more about the vaccine on December 10th, which is when the FDA will be sharing information about Pfizer's proposal and seeing if that vaccine receives its emergency use authorization. And then also Moderna, another pharmaceutical company, has application into the Food and Drug Administration, and we should learn about their approval on December 17th. We're trying to really focus on sharing how grateful we are with as many people as possible. There are so many great causes that are out there. We really have chosen to make this holidays about many of those great causes and those charities throughout our community versus looking in at ourselves as a family and just reflecting on the deep appreciation we have for being safe and healthy and being as fortunate as we have been. So it'll be a quieter holiday season, but we hope to make it a much more meaningful holiday season by engaging the whole family in the joy of giving. I'd like the many families in Northwest Illinois, of course, to remain healthy, to have a safe holiday season, but that doesn't make it any less joyous. and to really celebrate all we do have to be thankful for in caring for each other and our families. If I could ask our families throughout Northwest Illinois, is really think about what small actions that you can do to help support others that may not be as fortunate or may not be able to have such a joyous holiday season. By working together, we can truly make a difference for the community that we all live in.